What, great, thanks. Just want to welcome everybody to this conversation and this webinar, if you will, about the health of Philippine immigrants study. This is a big research project that has a long history, but we have some really useful and interesting data that we'd love to get worked on, if you will, and to the benefit of all of you individually, but more so to the benefit of the population of Filipino immigrants and even Filipinos in the Philippines, but also the bigger scheme of immigrant health research and moving that forward. So what we're gonna do is present sort of the nuts and bolts of the project. We'll get into some of the mechanics of the data and then open it up halfway through to some questions from all of you. Would that be okay? All right, Gil, do you want to introduce yourself, Gil, first? Oh, I should say, introduce myself. I'm Butch DeCastro. I'm a professor and dean at the College of Nursing at Seattle University. Recently hired there, coming out of 17 years at the University of Washington in Seattle School of Nursing as a professor and associate dean for diversity, equity, and inclusion. And my collaborator, Dr. G, go ahead.
Hi, everybody. I'm Gilbert G. I'm a professor and chair of the Department of Community Health Sciences at the Fielding School of Public Health. It's great to see all of you and to also see many of our team members, Adrian, Alika, Gabe, Krista, Angela, who am I missing? I'm probably missing somebody. Emily and Cowrie's been with us for a long time as well. So welcome to everybody. And if I missed somebody, I'm sorry. Feel free to shout yourself out.
All right. Karina, was that a suggestion to Gil that he forgot you?
Oh, I'm sorry. I didn't realize I was unmuted and I just needed to clear my throat. Sorry. Okay. Hi, everyone.
No, no apologies. Sorry if that was a bit of I didn't mean to embarrass you. Yes. All right. Well, just thanks everybody for being here. And again, our objective here is to inform you all of this research project and what is available in terms of opportunity to pursue some research scholarship on the topic of immigrant health, specifically with the data that we have available. So again, this project is called the Health of Philippine Emigrant Study. As I mentioned, it's got a long history, and we're happy to tell you about that if there's time in the discussion. But we want to just present sort of an overview of the project. And then again, as I said, we'll get into some of the data and the types of measures that were included, et cetera. So go ahead, Gil. So just wanting to start at a very foundational level, many of you are have done work in this area of immigrant health, but just to set the foundation of shared understanding, the prevailing notions of immigrant health are predicated on these two ideas of an immigrant paradox, where recent immigrants, if you will, fare better than more established immigrants or non-immigrants in the receiving country or destination country, even when they share the same race and ethnic identity. And this has been shown across a variety of health-related outcomes, physical and psychological health, and other sort of proxies for health. And the idea being that, despite the societal barriers that immigrants encounter that can hinder their integration into society, depending on many different contexts, that, it seems a little paradoxical that why would they fare better? So that's sort of a starting point for many, many folks interested in immigrant health. And then along with that, there's this idea of a positive selection, that those individuals that are healthier are able to migrate, to leave their country and go elsewhere around the world and start a new life, whether it be permanent or even temporary. And that they also are healthier, not just compared to folks that remain in their country of origin, but even relative to those in the country that they're going to. But however, what's the important point here is studies have shown that health advantage declines over time. Okay, there have been a lot of attributions to why that is. but nonetheless, still lots to explore as to why and how that happens. Now, I will just point out that the bulk of prior research has been based on cross-sectional studies that rely on self-report survey data that have been collected after people have migrated, and no real comparison group with regard to those in the country that immigrants have left. Okay, yeah, next one, Gil. So for the purposes of our study, we wanted to really dive into this idea of globalization, and that migration can't necessarily be seen as a unidirectional undertaking, but rather, with the world getting smaller and different forms of exchange of ideas and resources, that we really have to think about migration in this globalized context. So just to start from a simple point, our population of interest is migrants from the Philippines who come to the United States. And yeah, you could stop there and say, well, let's look at that sort of trajectory and what that does in terms of one's health. But we also need to realize that people in the Philippines before coming to the United States may have been exposed to lots of American ideas, foods, health behaviors, etc. And so, by virtue of transnational corporations and mass media, there's exposure, if you will, to how it's like to live in the United States, both not just intellectually or in the abstract, but actual, eating patterns, behaviors, etc. But also on a more personal level, many people, are related to folks that go to the United States or other countries, but then bring back also, products and again, ideas, information, all kinds of stuff. And so before people move to the United States, they are already to some degree exposed to what it's like to live in the United States or whatever country of destination. Next one, please. And so for us, the way we were thinking about this is for migrants on the lower level, certainly you have this idea of preparing. You're known, you have dreams and hopes to go to, let's just say the United States in this case, and you're going to make some preparations to do that. And that's sort of a big sort of category of preparation, but a number of things like do you have the money to do it? Do you have any responsibilities and commitments that you need to I guess delegate to others, like family care, if you will? And then do you have a job in the destination country, etc.? So then once you have all that settled, then you can actually make those plans to migrate. But then where do you migrate? Migrating to Seattle or Los Angeles is much different than migrating to Dallas, Texas, or Des Moines, Iowa, etc. And so the context of where you actually land or end up in terms of networks and ethnic enclaves and what you have access to is going to determine all kinds of things with regard to your integration into American society. What jobs are accessible to you? What foods are accessible to you? Where can you afford to live? What's in the immediate media milieu of your surroundings? And then when we say portion size there, specifically to diet, right? If you're living in a region where proportions of food servings is large versus elsewhere, that can dictate kind of how you socialize into what's acceptable to eat and all of that. And for that matter, exercise and stress management, all those kinds of things, which then could potentially lead to risk for weight gain and other unhealthy behaviors and outcomes. So that's what we sort of, in theory, think about the process of migrating. But however, if you think about globalization, so that can influence, again, as I mentioned in the previous slide, how people think about migration. But when you also consider non-migrants, people that stay in the Philippines, they're also exposed to these globalized ideas. They are not going anywhere. They're staying there. but they also have similar experiences around the kinds of community and neighborhood networks they're involved in or embedded in. There's a, in the Philippines, there's a whole issue about urbanization in large, megacities, which then adds to stress. And then again, dictating similar sort of everyday experiences around employment accessibility, educational accessibility, where can I afford to live, on, which can also then lead to weight gain as a result of those stressors. Okay, next one, please. So in our study, we designed a prospective model or study here, design, where we recruited a migrant cohort bound for the United States in the Philippines, so pre-migration, and our target N was 800, and we employed a survey, interview-administered survey, and we collected biomarkers, which we'll get into later. Then we did follow-up data collection periods, 3 months after arrival, then a year, 2 years, and then 36 months or 3 years later. That was our overall plan. We did, just to note, the beginning baseline and endpoint is where biomarkers were intended to be collected. We can get into that later. And that's why we don't do anything in the interim. And there's budgetary considerations of why we could and couldn't do that. But that's the model for the migrants. And we followed the same pattern with the exception of a 3-month follow-up for a non-migrant cohort, which was our comparison group. Okay, next one. So you might ask, well, where did you find these folks bound for the United States that were legally migrating? Well, we had many discussions with this government agency in the Philippines called the Commission on Filipinos Overseas. Suffice to say, it is the entity in which people migrating legally must pass through to get papers processed and signed and fees paid. And so everybody outbound, and this is for non-employment, there's overseas contract workers or temporary employment. This is not that agency. These are people bound to live in Canada, Australia, Japan, Italy, basically for the foreseeable future. So they have 2 offices. The one on the left is in Cebu, in the southern part of the country, and then the one on the right is in Manila, the capital city. And so we were able to recruit participants there based on the inclusion criteria, again, that they were bound for the US in the next few months, between 18 to 65 years of age. And I don't know why it says currently pregnant, but we said if you're known to not be pregnant, because this was a weight gain study, or a big portion of the data collection involved weight gain, we restricted on known pregnancy. All right, next one. With regard to the non-migrant cohort, so that was the migrant cohort, we used, we sampled from the community. So we did this stratified random sampling where we divided up cities, mainly Cebu and Metro Manila, into urban and rural strata. Then we sampled barangay level. At the barangay level, if you're not familiar with the term barangay, they're sort of like census tracts. They're administrative communities. And then within each barangay, we sampled households, and then we enumerated within households who was available, who was eligible, and then we sampled within household. And then we did based on, I should say, the criteria of non-migrants, we matched on education, gender, and age of those in our migrant sample, because we wanted to do a comparison. Okay. Next one. So with regard to response rates and attrition, so you see on the left there, our sample size for migrants is over 800, as well as for non-migrants. We had a baseline response rate there of a little over 36% and 68% respectively. And then our retention over time, as you might imagine, can be a challenge. So numbers went down, actually, some from 12 to 24 months, and not too bad. You know, we retain folks in the non-migrant cohort. And just if you're curious, we have a research team that we partnered with, or research teams we partnered with in the Philippines that really did data collection on the ground with the non-migrant participants. All right, next one. Okay, so Gil, maybe you could just punch to the very end of this 3 sets of slides. So this is just to show you that you know, relative to other big surveys, and in this case the American Community Survey, to look at the distribution by age and gender and education that was found in that 2011-2013 American Community Survey, that our sample actually mirrored quite well the demographics of Filipino immigrants in the United States. And so again, just the profile of our sample for our research study would be indicative and presumably reflective of the general population of Filipino immigrants in the US. Gil, do you want to add anything to that? I just want to...
No.
Okay. I'm just being mindful of time, so just wanted to speed through that. Okay, next one. And so you see here are some demographics. This is the migrant cohort, and you see over time. I'm not going to go through each of these specificity, but you can see that, you know, it's predominantly female. Our age, the mean age is in the mean 30s across the cohort waves. You know, decent amount of college education. We see increasing employment over time, and there you see BMI and the trajectory there, and then the report of fair or poor health over time has also has increased. I'll just point out that the last column there, the 48-month follow-up, is the beginning of a separate but connected prospective study that we're calling HOPES Sleep. And so that is that project recruited from the original sample of migrant participants in HOPES and recruited them for enrollment in HOPES Sleep, which focused on sleep. And that's why you see the numbers a little bit different there, because it is a subset of the original HOPES sample. And we can get more into that later. Gil, thanks. Next one. Then just for your information, again, for comparison, we have a table of non-migrants to give you a sense of the distribution across these demographic categories, as well as BMI over time and the self-report of fair and poor health. Okay, and again, after, you know, if people have questions, I'll just point out that the non-migrants were not included in HOPES Sleep. That was just among the migrant sample. Okay, all right, next one. So with regard to all of you who are interested in utilizing or exploring this data, what we have available are code books of the data that cover the baseline 3-month and 12-month waves. So we're continuing to work on that as we move forward. But, you know, we have that available for you to explore and figure out what are potential analyses of interest. Biological markers that we collected are assayed, and, you know, we have data on that and different levels for different biomarkers, but we have frozen samples. So in case you're interested in exploring new analytes on new markers, we have dried blood spots collected that are frozen that we could access for your measure of interest. And then from statistical perspective, we have weights for how to work with the data and instructions to you know, set up variables a certain way. And then also geocodes. So let's go to that last one there for my part. So we did at the 12-month mark look to see geocoded people's addresses, to see where were people landing over after a year. And you can see there's quite a nice distribution, you know, some concentrations naturally on the West Coast and in the Northeast, But if you are interested in looking at geographic context, we have data that can indicate where people are. So with that, I'm going to throw it to Gil.
All right, yeah, and we are missing Alaska and Hawaii, but we do have participants in Alaska and Hawaii here. And I should mention that there was a typo here. We actually do have code books for the 24-month and the 36-month, and we also have a preliminary code book for Hope's Sleep.
Thanks, Gil.
I wanted to go back a couple of slides and just say amplify one thing that Butch had mentioned. Our study design is exceptionally unique. I would say 99% of studies of immigrants are cross-sectional. There's only a handful of longitudinal studies. And of those, I believe there's probably maybe 3 studies in the literature that include data from before people leave their home country. So there's some data from Mexico, some data from Russia. And for us, we are very unique in not only having longitudinal study designs, but also having data before people leave and having comparison cohort as well. I think there's only one other study, which is data from Mexico, that also has a comparison group. So our study is really unique in that way, as well as the partnership with the Commission for Filipinos Overseas. That's also been a very unique experience. And Butch and I can talk about our work with that federal agency and how we were able to develop the relationships and all that, in case anybody was interested. So what I'm going to do now is just really quickly give you an overview of some of the measures that we have. This won't be comprehensive because we measured a lot of stuff, but this is really for some of the things that are possible. And we really, really do encourage all of you on the webinar, and tell a friend, like and subscribe to use the data. We view this as a resource for the community, and so we really want to help learn about Filipino immigrants. Specifically, we want to build the careers of junior investigators. People like Adrian, for example, wrote his dissertation on this and got an F-31 federal grant as well out of it. So we really, really want all of you to to use it, or at least pass it on and see if your friends want to use our data. Okay, so are some of a snapshot of the things that we measured. So at baseline, we collected a lot of information on demographics, things like age and sex and income and so forth. We collected measures about employment. We collected health measures. We can talk about that. Social networks, diet, physical activity, and cell biomarkers. And I'll go through a few of these in a little bit more detail later. Because surveys are burdensome, we didn't ask every single question at every single time point. So we figured, for example, if we knew your age at baseline and we knew when you took your next survey, we could figure out your age. But here gives you sort of that blueprint of how we collected many of our measures. So we did measure weight and height, hip circumference, waist circumference. We did a lot of training of our staff to ensure that we really use state-of-the-art, reliable and valid measures. We did collect dried blood spots, analyzed for things like C-reactive protein and triglycerides and so forth. We also had people weigh themselves on a scale so we could get body fat and so forth in addition to weight. We asked a lot of survey questions about health. We asked about things like cognitive impairment, help seeking, medications that they use. So when we took biomarkers, when we took the dried blood spot samples, we also asked people, for example, did you have an infection in the last 2 weeks? Are you taking medications and so forth? We have a lot of questions on social factors, on things like stress, on experiences of discrimination, some data on political, things on metadata, religion, and so forth. Questions about immigration. So, for example, do you send remittances? Do you expect, now you're all bound to the United States, but do you expect to come back? And then we also asked, depending on the point in time, questions like that. Do you plan to enlist in the Army, for example, and so forth? We asked questions about being homesick and whether people just want to come back to the Philippines and so forth, and also about organizations that might help them as they resettled. We did ask a few questions about politics, and interestingly enough, launched the study, we had 2 new leaders take office. So when HOPES began, we had a new president in the Philippines named Duterte, and in the United States, we had a new president named Donald Trump. And when we launched the survey, we were quite nervous because both leaders had very strong views of certain things, and we were worried that some of our participants might be hesitant to answer questions about things. So we were very mindful in terms of how we put together questions. We even took out a few questions on things like substance use, because we felt that that would make people very nervous and might even compromise them given the political situation. We asked them some questions about things like life in the United States. What has surprised you most about being here? What are some of the biggest challenges and so forth? And we also asked about networks and friends. Because we're very interested in issues of race and racialization, we did ask, for example, about race of friends and things like that. We, of course, asked about remittances. We asked about where people get news information and so forth. And this goes back to our transnational framework, where we believe that immigrants don't just come here as blank boxes and acculturate, but actually they learn things and they send information back and forth. Okay. And let's see, we asked questions about employment. We asked questions about service and so forth. Insurance, health behaviors, things like vaping at some points in time. Okay, and so that was a lot of the general stuff that we measured in HOPES. And as Butch mentioned, we did embark on an extension of HOPES, which we called HOPES Sleep. And again, to clarify, HOPES Sleep is only for the migrants, and it excludes the non-migrants. And really the goal of the HOPES Sleep study is to understand what are sleep challenges for Filipino immigrants, what are things, especially stressors that might contribute to sleep deficiency. We want to understand the mechanisms whereby stressors contribute to these deficient sleep problems. And we also had a qualitative arm led by Gabe Garcia, who's here as well, to learn about sleep practices, beliefs, and attitudes. Maybe before I get into the sleep measures, Gabe, do you want to just say a couple things about the qualitative arm?
Yeah, so last year we completed collecting data, interviewing approximately 60 respondents. And this year we are planning to do a follow-up interview with those 60 respondents to get that started again. But we're learning a lot of new things with the qualitative interviews that we're doing.
Yeah, thanks, Gabe. Yeah, fabulous job. 1 hour long, in-depth interviews. Okay, for the sleep study, we currently have 205 participants. And of those, about half of them, we have done actigraphy, and I'll explain what that is in just a second. But here's our general framework for the sleep study. The basic idea is that as people immigrate to the United States, they move into new physical environments that can be stressful, right? And so, I remember when I talked to a few of the immigrants and I some concerns about moving to the United States, a lot of them said, oh, it's going to be really cold. So, the physical environment can be very important for people, as well as other environments that they may encounter, including where they work, maybe their home quarters, if they have roommates and so forth. We believe these dietary changes, it may cause them to ruminate about their lives and about their stressors. And these things can directly impact sleep, their circadian rhythms, and so forth. We also know that people might cope with these stressors in their lives through maybe, kin networks, social support, religion, and so forth. Interested in how culture shapes all of these experiences, as well as the physical environment. So whether you live in a place that's really noisy and, whether there's a lot of light and things like that. And so we collected a variety of sleep measures. That includes actigraphy. So this is an objective sleep patterns. Basically, people wear a watch that has like an accelerometer on it and a light sensor. And we use this to, and they're supposed to wear it for 10 days straight and only take it off when they say go take a shower. And so from this, we can infer when people are asleep. We can infer what time they go to sleep, whether they wake up, those kinds of things. And those sleep patterns are correlated also with a sleep diary that they are supposed to complete every night. So between the sleep diary and the actigraphy watch, we can get a decent sense on people's sleep patterns and interruptions and so forth. We measured a whole bunch of things. I won't go into a lot of detail about this, but one thing to point out is we also included questions about COVID. I should mention that wave 3 of hopes coincided with the beginning of COVID. So, Butch and I were all set to get on an airplane to go to the Philippines in March of, I think, 20. Looked at each other and said, maybe we shouldn't go. And I'm glad that we didn't go, because I wouldn't want to risk getting trapped in another country at the start of COVID. But we had excellent staff that worked out there. So for a sleep questionnaire, we did ask questions about COVID and so forth. So I won't go through all these questions, but we do have these slides here in case you have targeted questions, and we can kind of look at them in some detail. We've had a series of publications that have come out from our study, and I invite you to peruse them, and we will make these slides available so you can look at them. Substantively, we did find, I believe, a few very important things from our study. Conceptually, we have advanced this idea that visas are an important marker of immigrant status. Most of the time, we think about things like education and income as markers of social status, but the kind of visa that you hold is particularly important for immigrants. We've advanced this idea of pre-acculturation. We've done studies on the healthy immigrant effect, a lot of them written by Adrian, for example. So there's so much more to be explored, as you can see by the wealth of measures. I do want to give a shout out to our current project manager, doing an amazing job of just keeping everything together. So feel free to message her and who's also part of our team. And we have other members of our team. I don't have my camera on, so I can't give a shout out to everybody, but I will in a bit. But we do have so many amazing people. And this research, just so you know, Institutes of Health, and again, in collaboration with many partners, including the CFO, the Occupational Health Nurses Association of the Philippines, and dozens and dozens and dozens of wonderful people. I don't think all their names are there. But with that, I want to maybe stop here and open the floor to any questions. And
yeah, we'll look to Angela to help moderate any hand raising.
There was a question earlier in the chat. I kind of helped answer it, but in case you wanted to touch on it more, someone asked if there is data from multiple people from the same family/household.
Yes. So we do have some people who are, there are some people from the same family. And we do have indicators of that, and you want to model that appropriately if you.
And then Adrian, raise your hand.
Yeah. Hi, Gil. Hi, Butch. Long time no see. Hope you're both doing okay. In terms of one of my questions, so one of the things that was done during was the biomarkers. Do you have any sense or news as to the quality of the biomarker measures? Because obviously that was collected a lot differently than when we did at baseline.
Yeah. Butch, do you want to take this, or do you want me to say
something? Let me give some overarching comments, and then you could explain what actually, what kind of happened in terms of execution of the protocol. So, we wanted to have the same collection protocol in the Philippines at baseline, as we did in the subsequent year, in this case, 36-month mark post-migration. Our plan was, and in the Philippines we did this, we had, people that, research staff that actually collected blood pressures and collected dried blood spots, et cetera. So it was done in a very trained and controlled way. Our plan in the United States was to, if you will, send out a research nurse to do the same thing, or some sort of research staff member that was trained to the same protocol as was done in the Philippines at the pre-migration baseline. This was in the midst of COVID and lots of research activity shut down, if you will, by research universities. And so we had to modify and pivot as to how we collected. So Gil, I'm going to hand it off to you now. Could help as well explain what was done to get some biomarkers.
Yeah. So again, at baseline, we had nurses go out and take a finger prick and with a very strict protocol, and they, would drop blood into cards, and we sent them to the University of Washington for analysis. Now, our plan was in the third year, wave 3, to do biomarker data collection the same way we did it at baseline. And we had actually a contract with a company called EMSI that had worked with N. Haynes. So we felt very confident because they had worked with N. Haynes, they had staff across the nation, trained and everything. We were very confident that they could do this. The problem was COVID, because the whole business model of EMSI was in-person data collection. And with COVID, there was no in-person anything. So they went bankrupt. And so we had, what are we going to do? And I think, like most people, we sat for a while just trying to figure out, is this pandemic going to end in a week? We don't know. We just waited for a while. And finally, we decided that we needed to do something. So what we ended up doing was we had people selection of dried blood spots, which is not ideal, right? It's a different protocol than baseline where we had nurse go out, but we did the best we could. We mailed a kit to people. They got this little round, kind of
a collection device.
Yeah, thank you. And they were instructed to, basically puncture their finger and then drop a few drops of blood into a card. We did do some pilot testing of, the usability of this methodology, and our lab tests looked like it was pretty good. That said, of course, in the field, things can be a little different. So it's really not 100% known how good that third wave of biomarker. We feel very confident about the baseline, but we're not 100% confident about wave 3 biomarker data collection. And so we did think very carefully, and the lab people, our partners at the lab, really, really thoughtful about it, and they made some recommendations. And it's a little bit out of my bailiwick, and maybe Butch, you could get into some of the more technical stuff about, the analysis. But it's available for a subset of participants, but we're not 100% confident about about how good it is.
So with, our lab analysts or lab team that has worked with biomarkers, they have recommended a correction factor, if you will, or an adjustment factor. So you could think about it as a weight of sorts, to try to calibrate in a equal sort of way of thinking about the lab value, whatever analyte that we analyze for. The other thing I'll just say really quick is we also had people do their own weight, do their own waist and hip circumference, do their own blood pressures. So yes, while it is something, we need to acknowledge that there are constraints and limitations for how people self-collect, right? Like, did they have both feet on the ground flat while they were doing their blood pressure versus legs crossed, if you will? So, we did extensive training with participants when they got the kit the collection kit of all this equipment. And so we are hoping that at least, it's something to work with.
Yeah. So there's a question in chat. Adrian, did that answer your question?
Yes, it did. Thanks, Gil. Thanks much.
Okay, great. Okay, there's a question in chat. Did you find patterns of regional migration in your sample, and do any sub-analyses on health or density of networks and so forth? So that would be a great question. I don't think anybody's looked at those questions yet. So if you're interested in asking those questions of our data, I would invite you to check out our codebook and to take a look at the data and maybe run those analyses yourself. Yeah, and one thing I should note is we did surveys in Cebuano, Tagalog, and English, but not in Ilocano.
That question, or can we add any more?
No, that was
great. Thank you.
Okay.
Sorry, Dr. Palma. I did get a question prior to this event because there are some people, unfortunately, who weren't able to make it for whatever reason. They wanted me to pose a question and get your response so I can respond to them eventually. Is how long do you plan to conduct the sleep part of this study? How many years are you hoping to try to get that data?
Yeah, well, we were hoping to get 4 years of follow-up from our sleep study. I'm not sure if we'll end up getting 4 years, but that was the original plan. So right now we have, data collected on 200, and then we have a subset, maybe it's like 20 or 30, where we have a fifth wave of data on them. So we are kind of rolling that along. So.
Okay, let me just say something else while others are thinking about their questions or sharing their insights. Just another plug for the richness of the data set. While we are couching this as a health research project, and my area of expertise and studies in health, but the data do allow for all kinds of analyses on a variety of fronts. So those of you who are not necessarily so versed in health research, there are other indicators and measures of other kinds of sociologic phenomena. So just wanted to help you all realize that there's lots of directions to go in.
Right. So like one question as an example would be like employment patterns of people as they immigrant. Most people come to another country to have a better life economically. Those are open questions that we can explore with this data. All right.
Did we mention that we are not charging to use the data?
Gil, maybe if I can ask another question per se. I'm thinking a lot for the trainees. Are there any opportunities for trainees to potentially do analysis with the sleep data, perhaps apply for like diversity supplements for the sleep data? Anything, potential K awards for people as well?
Right. Thanks for that. Yeah, I think absolutely yes. And so, if there are, for example, doctoral students who are looking for a dissertation or a master's thesis, or even maybe a summer project, that's how Angela got involved as a summer intern, right? And now she's our project manager. We really care a lot about, building the field. And so we definitely welcome trainees. And yes, if you wanted to use this as the basis of writing a training grant, of any kind, it could be pre-doc, post-doc, and so forth. post back, and so and whatever. That's definitely a possibility. We really do want this to be a resource, and hopefully something that can help help build a few careers as well. So there's a question about if you're interested in looking at the biomarkers, what's the process? Right. So we can send you a copy of our codebook, and you can take a look at what measures are there. And it would be great if you could email Angela. And Angela, if you can repost your email and so forth, the contact info, then we can have a conversation. What we ask is if you are interested in working with our data, is you submit a data use agreement. It's only about a page or so. Onerous. The main issue is, one, we want to know what variables you need, because we're not going to give you all the data. We'll give you the data that you need, partly to protect confidentiality of participants and so forth, and two, because the data are so big that they just don't fit on most emails. And then also to make sure that there's no redundancy. So we don't want two teams working on the same question by accident. And so that's the other reason, just to kind of manage to make sure that we're not doing duplicate work. But that would be the general process. So contact Angela, we'll send you some code books, and then we could have a little bit of a back and forth on what makes sense. Okay.
Yeah, I'll just add with regard to biomarkers. So they're housed at the University of Washington. And so depending on what you're thinking about, the analysis could be done in-house here in Seattle, or if there's a need to ship, something to you process, and there could be some issues around integrity of the samples, et cetera. So again, while, yeah, you could fill out the data use form and look at the code books, it is worth a conversation to kind of think through a little bit, and we could invite our lab folks into that conversation to think through what makes the most sense. So just want to point that out. Next question is on measures or questions used for the depression section. Gil?
Yeah, I don't remember exactly. It might be the NIH promised sleep battery, which is something like 4 or 8, or does somebody know off the top of their head? Because I don't remember.
Making sure you heard me, depression, not sleep.
Yeah, I meant to say depression battery.
Okay.
It's either that, or it might have been something like the CESD. We tried to use standard measures whenever possible. And I'm just blanking out on exactly which one we ended up using.
Yeah, Gil, I can clarify that because I did it for my dissertation. It is the NIH questions, so a 6-question scale. And I think we have, at least while I was there, we have the documentation as needed for scoring and whatnot as well.
Great, thank you, Adrian.
And on the heels of that, I'll just say with regard to translation, we did employ a pretty rigorous process with regard to translation. We used translation by consensus, where we had individuals separately translate English language questions, both in terms of phrasing, but also cultural concepts or cultural articulations of what we mean by being restless, for example. It brought the group together and had a lot of discussion around what would make the most sense, not just linguistically, but culturally as well. So
there's a question about the cohort in both countries being maintained for future study, and then another question about how we built the relationship. The first one, and maybe Butch, you can get us started on the second one. So right now we do have, I believe, the contact information for all of our participants. Whether that contact information, people move and things like that. So I'm not 100% sure how much of the sample we'll be able to recover if we were to keep extending it. But right now, the plan is to retain that information so that we could conduct more research if we can get the funding. So let me turn it over to Butch about relationship building with the other country.
Yeah, so when we were first conceptualizing this whole project, the core question was, how are you going to find who the heck is immigrating to the United States and when? what shopping mall should we go to? What restaurant should we eat at? What street corner or alleyway do we need to walk through? And we just didn't know. And lots of discussion with some colleagues in the Philippines, researchers, as well as, if you will, people that work in the health practice arena, suggested, say, well, you know, we have this government agency called the Commission on Filipinos Overseas, where all legal emigres need to pass through. And we said, huh. And we tried to learn more about it. And if you could imagine, it's something like the motor vehicle department, where if you want an identification card or a credential to drive in the form of your driver's license, you must go to this government entity and process papers, pay your fees, etc. And in some ways, this Commission on Filipinos Overseas is very much just like that. You go to one window, you get a ticket, and then you do your thing, you sit down, wait for the next window to call you. So there's this whole process. So Gil, I want to, in my head now, it's hard to remember, over a period of maybe, we did some really intense relationship building. We started out in as much as a community engaged, participatory, principled way of introducing ourselves, and we were very mindful of cultural differences. While my family is from the Philippines, I was born in the United States, so I was very conscientious about how I approach things, not making any presumptions that just my simply being of Filipino descent, that I would know how to traverse those conversations. But we had a series of meetings over time, learning about them, offering offering just who we are, sharing about what our interests were in. We talked about our own research and why we came to the conclusion of the importance of studying migration and health. And interestingly enough, that government agency's main priority is the well-being of Filipinos overseas. So, if you will, our intellectual as well as their governmental mandate were very much aligned. And so they were interested in working with us and giving us permission to recruit migrants that were coming to the United States. Now, I just want to briefly say, and I know there's other questions, we also building relationships with the research teams on the ground in the Philippines, who would then have the inroads to collect data with non-migrants. And so we worked with a demography team that did a lot of general population studies that was based out of University of the Philippines, Diliman, and then a group in Cebu that was also with a bunch of demographers and biological marker experts. And so they were equal partners in this, and they helped us with the general population recruitment of general population participants of the non-migrants.
Yeah, and let me just add a couple of things. So I'm not Filipino, and so every time I went to the Philippines, and Butch and I would travel there a lot. The question would always come up, like, why are you interested in this work? And I had to give my Asian American answer, which is, once you come to the U.S., we're all racialized together, blah blah blah, which wasn't a good answer to them. And I do remember having a meeting with an official once, and I was giving that answer, and then a friend of mine in the audience goes, "But he ate blood," and suddenly the guy's eyes were like, "Oh wow," But here's the thing: the federal agency is led by political appointees. So every time there's a presidential election, there's a new leader. And every time there's a new leader, Butch and I had to fly to the Philippines and do our dog and pony show. Like, here's our project and blah, blah, blah. The real key to this were the staff that were not political appointees, that were kind of there working for many years. We built good relationships with them. We realized that their hearts and our hearts were aligned. They truly cared about the health and well-being of Filipino communities. And so because we had a good relationship with the staff, then they were our brokers to the new leadership. So every time a new leader came in, Butch and I would fly over, then we would, kind of do a meeting and so forth, bring some presents or whatever and talk. And then the leadership would feel comfortable with us, and then they would just hand it over to the staff, right? But that was really the major key, was really the staff and being lucky for us to be aligned with in so many ways. So that would be the one thing I got.
And I noticed 2 more questions and some limited time, but since this is being recorded, when Gil said we brought presents, these were token gifts, like pens and just sort of like university swag. So just to be clear. But the question is, have your community partners expressed a priority or preference in terms of topics, questions to address? I mean, not necessarily specific lanes, but generally like findings that would indicate what it's like in the experience of a migrant to move from one country to another. And again, I know we're focusing on the migrant cohort, still lots of data on multiple fronts with regard to the non-migrant cohort and what our research partners in the Philippines are interested in exploring. But it really is wide open. I wouldn't say there's really a priority topic or question. And then the last question I think we have time for within this slot is, can scholars in the US request data access? Thinking mainly of GradMap PhD students and their master's doctoral. Is that, I guess, GradMap public health students and their master's doctoral thesis, etc. So, in the Philippines, I guess. Okay. Have we had international collaborators yet, Angela, sign on or use data?
Yeah, most of them have been international student scholars. Yes, we have had proposals submitted, and some of them have been accepted. I can't remember the specific name of one of them though, but I can send you more information about it if you're interested.
Yeah. So very much welcome that.
Yeah. All right. So we have about 1.5 minutes left. Any last burning questions?
All right. Well, maybe in closing, we could just say thanks. But Gil and myself and Angela are always open to setting up an appointment for conversation. Think through what's available to you through this data set. And again, we are looking at this not just from a scholarly endeavor, but a professional advancement endeavor, where particularly those of you who are early stage investigators want a platform to build your future career on. Gil and I always sort of close with this. We have benefited from other folks, senior mentors that we built our careers on with regard to accessing their data set. And if we could just pay it forward, that is our hope as well. So just want to appreciate all of you for spending the last hour with us, but please do reach out. We welcome it.
Right.
All right. I can hang for a little bit if people just want more just kind of transition time.
Yep. Yeah. So we can hang out for a few minutes in case anybody wants to chat a little bit after, but you're welcome to go. Thank you so much for your time.
Yep. And Angela, you can stop recording. Thanks.